If you're a parent, you know that feeling, right? That sinking pit in your stomach when your kid suddenly has a tummy ache, starts vomiting, you know the drill. It's one of the most common things we deal with. But here's the thing. Sometimes it's more than just a 24-hour bug. So today, we're going to break down what's really happening when they get sick, and more importantly, what you can do about it.
All right, let's just jump right in with a question. Think about it for a second. What is the single biggest reason that kids get sick and have to go to the doctor or the hospital, not just here, but all over the globe?
The answer is acute gastroenteritis. I know, it's a mouthful. It's just the fancy medical term for what we all call the stomach flu. That really sudden, nasty bout of diarrhea and vomiting that can just completely wipe a kid out.
And there's a reason we're calling this section the real stakes. Because even though this illness is incredibly common, the risks that come with it are actually pretty serious. Understanding them is absolutely the key to handling this the right way.
So what is actually going on in their little bodies? Well, at its core, gastroenteritis is an inflammation of the gut. The stomach and the intestines get swollen and angry, and their natural reaction is basically, get everything out of here, now. And that's where the vomiting and diarrhea come from. Now, a whole bunch of nasty critters can cause this. You've got your usual suspects like viruses, think rotavirus or norovirus, bacteria, and even parasites. But here's the crucial part. No matter what the specific bug is, the immediate danger that we need to be focused on is almost always the exact same thing.
And that brings us to the main event, the real villain of this whole story, dehydration. And listen, this isn't just a side effect. It is the most common and most dangerous complication that we have to be on the lookout for.
I want you to really pay attention to the wording on this slide. This is directly from the source material. Primary driver of morbidity and mortality. That's just the clinical way of saying it's the main reason kids get seriously ill or even die from this. It's not the virus that's the biggest threat. It's the loss of all that fluid.
This image, wow. It really hits home, doesn't it? It shows you exactly the kind of physical toll that severe dehydration can take. The body is literally running on empty. It's running out of the water it needs for every single function. So, the name of the game is learning how to spot it and spot it early.
Okay, let's walk through the warning signs together. When it's mild, your kid might just be really thirsty, but they're still alert and acting pretty normal. But when it gets moderate, that's when you'll start to see them get irritable, maybe lethargic. Their mouth will be dry, maybe their eyes look a little sunken. Now, severe dehydration, that's a real emergency. They might be drowsy or hard to wake up, their pulse is weak and fast, and you'll see something called poor skin turgor. That's where you gently pinch the skin on the back of their hand, and it doesn't snap right back. That is a huge red flag.
So, severe dehydration isn't just a single problem. It's more like the first domino that falls, triggering this dangerous cascade of other problems inside the body. Let's take a look at how that whole chain reaction works.
You see, when a kid is losing all that fluid, they're not just losing water, they're losing critical body salts called electrolytes. You can think of it like a car battery losing its battery acid. The whole electrical system just starts to fail. Nerves don't fire right, muscles get weak. At the same time, the body's entire pH balance gets thrown way off, which can lead to something called metabolic acidosis. That's actually why you might see a really sick child start to breathe very quickly and deeply.
Now, if the illness really drags on, something else starts to kick in. It's called the malnutrition diarrhea cycle, and it is a truly vicious feedback loop, where each problem just keeps making the other one worse.
So here's the first part of that loop. The diarrhea itself starts causing malnutrition, which makes sense, right? The child feels awful, so they don't want to eat, they might be vomiting, and their gut is so inflamed it can't absorb nutrients anyway. And all this is happening while their body actually needs more fuel to fight the infection.
And here's where the cycle turns on itself. Being malnourished makes the diarrhea even worse. The weak body can't produce the enzymes it needs to digest food, and the immune system is basically running on fumes, so can't fight off the bug. The illness just drags on and on.
Okay, I know, that was a lot of the bad stuff, but now we get to pivot to the solution. This is the good part. This is your action plan, the playbook for how to manage this safely and get your kiddo back on their feet. Look, the whole strategy really comes down to these 6 simple principles. Number 1, always, is to keep checking their hydration. Number 2, replace what they're losing with fluids and electrolytes, and oral rehydration solution is best. Number 3, and this is a big one we're going to talk more about, is keep feeding them. Then, of course, you want to prevent it from spreading, figure out the cause if you need to, and, this is critical, avoid treatments that can actually make things worse.
This next point is so important we gave it its own slide.
For decades, the old advice was to rest the gut and not give a sick child any food. We now know that is completely wrong. This quote says it all. Feeding them early doesn't make the diarrhea worse, it actually helps them recover faster.
So what does that actually look like? Well, here are the simple do's and don'ts. Absolutely do keep breastfeeding. Do give them their normal full-strength formula. Offer small, frequent meals of easy-to-digest stuff, like complex carbs, think rice spread, that kind of thing. What you don't want to do is stop all food, water down their formula, or start introducing brand new foods their stomach isn't used to.
And here we have a rule with 0 exceptions. Never, and I mean never, give a child over-the-counter anti-diarrheal medication. Think about it. Diarrhea is the body's way of flushing out an infection. If you stop that process, you're essentially trapping that virus or bacteria inside their body, which can lead to some really serious complications. Just don't do it.
Okay, let's wrap this up with the most important part. These are the red flags. These are the clear-cut rules for when you stop trying to manage this at home and you get on the phone to a doctor right away.
The very first and maybe most serious red flag is any blood in their stool. This is not something you see with a simple viral bug. Bloody diarrhea is a major sign that there's probably an invasive bacterial infection going on, and it always requires a doctor's attention.
And to help you remember the most common bad guy bacteria that can cause this, our source gives us this handy little mnemonic, CASES. This stands for things like Campylobacter, Amoeba, Shigella, E. coli, and Salmonella. These are the kinds of culprits a doctor will be looking for.
So, here it is, your final checklist. It's time to call the doctor if you see any of those signs of moderate to severe dehydration we talked about. Call them for any bloody diarrhea. Call them for a high fever, or if their tummy is swollen and really painful. If they're vomiting so much they just can't keep any fluids down, you make the call. And finally, trust your gut. If your child just seems really sick to you, that's always a good enough reason to get help.
You know, when it all comes down to it, that's what this is about. This isn't just a bunch of information, it's a tool. Knowing the difference between a simple tummy bug that just needs some cuddles and fluids and a serious threat that needs a doctor, that's a superpower for any parent. So the only question is, how are you going to use it?